R3.
I've been a flight nurse with SkyHealth since we started, and I've been a nurse approaching 19 years now. It's not one of those opportunities that typically arises in a nurse's career. I was very fortunate. It's one of those opportunities to do what I love as far as taking care of patients in a much more challenging setting. It's been an incredible experience for me.
SkyHealth is a mobile intensive care unit. We can transfer patients with severe and critical and traumatic injuries, including those with severe infections or sepsis, heart attacks, devastating neurological injuries including brain bleeds and strokes, or those with severe traumatic injuries. Our Y-axis transfer center informs us about patients arriving via the SkyHealth helicopter prior to their arrival so that we can make plans and preparations before the patient comes to our hospital.
A lot of patients are sent via SkyHealth from one hospital to a higher level of care because we can provide that ICU level care while in transport, which is not always available on the ground. And SkyHealth has the ability to fly, we average maybe 120 miles an hour, and we're not constrained by traffic.
Once the pilot has confirmed that it is a mission that's acceptable, that's safe for us to complete as far as weather and weight, the communication center will then tell us, the medical crew, what diagnosis the patient has, where they're going, and if there's any specialty equipment that's required that we need to load onto the aircraft. But at that point we are ready and out moving and getting strapped in and looking over our final checks and ready to launch.
We'll share ideas, share observations, come up with a care plan together, make sure that we both agree on what's best for the patient, whether we can bring a family member, whether we should even fly in the weather conditions. We always work with the pilot to make sure that everything is safe.
And we all use crew resource management where it says 3 to go, 1 to say no. So if anybody has an issue with wind, visibility, they can actually call off a flight. The main safety feature on the EC-135 is the twin engine. So if one engine fails, we have a second engine that we can fly away and land safely.
When the SkyHealth helicopter arrives on the helipad, they're greeted by our security staff and the emergency medicine technicians who help the flight crew safely transfer the patient from the helipad to their designated treatment units.
SkyHealth is an example of what an incredible team can do together. It's not a single person that makes this a success. I think the most important part of what we do is our communication, and we all have that shared goal.